Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in Ayurveda Academy YouTube channel. This particular video is related with the lecture regarding the Ayurvedic paediatrics. Ayurveda has also a very good information how to treat, how to understand the small babies from the birth to the age of 16 years. And that particular branch of Ayurveda is called as Kaumarbhritya tantra or Balrog. So some people they don't know that Ayurveda has also specialization and super specialization. Remember these things. My dear viewers, all my subscribers, I would like to tell you that Ayurveda having Ashtanga Ayurveda, 8 super specialties in Ayurveda. Kaya, Bala, Graha, Urdhvanga, Shalya, Danshtra, Jara, and Vrishan. This is called the Ashtanga Ayurveda. So we have the Ayurvedic physician, Kaya Chikitsa, Bal, Ayurvedic pediatrician, Shalya, Ayurvedic surgeon, yes, Chalakya, Ayurvedic ophthalmologist and ENT, and also the Rasayan and Vajikarana, Ayurvedic people also have the Afro, that means the sexologist. So these are the super specialty branches. And today we have the discussion about Ayurvedic pediatrics, the children. And we have taken 4 important topics from this Balaroga. These topics for the students are important because these questions are asked in the previous question papers. So first, I would like to request to all my viewers, especially students, please write down today's topics. Then I will start. Slowly and steadily. Otherwise, you can take always a screenshot. Snapshot is facility also there. Whenever you are running any video, there is a snapshot. Okay. So MR vaccination. This is a typical vaccines for the rubella, German measles and measles. Then ABS palsy. Palsy is like a paralysis. Palsy is like a paralysis, losing the power of the hand. That is palsy. Then cervical, cervical here, lymphadenopathy. Lymph glands are enlarged. We have the different places where we have the lymph glands predominant. One place is cervical, second is axillary, then go down inguinal. So these are the 3 important places where we get the lymphadenopathy, lymph glands are enlarged. Most of the time, if there is a nearby infection, for example, I have the infection in the foot, then I get the swelling in the inguinal region, the lymph gland becomes enlarged. If I have something problematic in my hand here, wound is there, and then I can get a axillary lymph gland enlarged. If any lady, in adult, this is not a pediatric, in adult breast cancer, these axillary lymph glands are palpable. Similarly, we will talk today about this one, neck, cervical, supraclavicular, here, lymph glands. Herd immunity. I know this is not a specific topic from a particular point of syllabus. These are the varied topics. But these, all the 5 points are important for the examination as well as in the practice, as well as this type of the patients are there. For example, in Ayurveda Academy, lot of people, they come to take the treatment of muscular dystrophy. So any viewer, subscriber, having any relatives, the child, adults suffering from muscular dystrophy, I request, please, you can come to us. We have the excellent Ayurvedic pediatrician. The name is Dr. Sudha Singh, madam. Of course, under the guidance of Professor Deshpande, the treatments are given, but we treat this type of the cerebral palsy, muscular dystrophy. For paid online consultation, you can WhatsApp me on 9226810 The number is given in the description. Let us start further. So MR vaccination. Here you can see measles and rubella vaccine, live vaccine, MR vac. 0.5 ml is 1 dose. So just to understand how it looks like, I have shown the picture. Now, Let us talk about the MR vaccination in India. The target, why this vaccination is given, who are the people to whom we should give this vaccination. This MR vaccination gives the protection age 9 months to 15 years. If we give this vaccination, these particular children from the age 9 months to 15 years, they will not get measles and rubella. These two diseases can be prevented by giving MR vaccine. Why we should give? Goal, these WHO, both these diseases eliminate by the 2023. Originally said, this is the first 5 years back, it was thought about that, but unfortunately it is not totally eradicated. Today we have the 2024. So my dear friends, I understand the vaccination also has to be more distribution to the different people, society, locality, and then everybody will be vaccinated, and then the disease is totally eradicated. Like for example, smallpox gone, polio gone. But till today, measles and this rubella are not totally gone. So here the word is ongoing effort, step by step. We will try, never cry. So vaccine is always a continuous efforts process. Scheduled. How it is given? Routine doses are 9 to 12 months. This is the first dose, and then 16 to 24 months we can give the second dose. So this is catch-up campaigns for the missed doses. Okay. First, it should be given from the month after birth, 9 to 12 months. Before the 1 year, it should be given. Now campaigns, the camps, special drive to reach all the children, even previously vaccinated, like the polio. This continuous process should be continued. Success. Over 348 million children vaccinated since 2017. And this has excellent results. The significant, the disease patients number is reduced. This is the success. Vaccine. How it is a vaccine? Vaccine is safe and of course effective. This vaccine, MR vaccine, used globally all over the world as a part of routine immunization. What is the importance of this vaccine? Measles, this particular disease, kill thousands the people annually. The children, of course, the children are died because of the measles complications. Rubella can cause birth defects. If the mother is getting the rubella in the pregnancy, the child will suffer. It will get some genetic problem. Birth defects will be created. Now, MR vaccine coverage. These are the different points. Accordingly, you can write as a SAQ. Aiming for 95% with 2 doses for elimination of the diseases. Recent efforts, targeted campaigns in several states to cover last mile children, remote areas where the people are living near to the mountains and the forest, Adivasi. So all the campaigns, camps are done by the government in the remote places. That is most important. Now, what is the challenge? Reaching remote areas is difficult because there are no roads, there are no ST buses, there is no aeroplane, there is no helicopter, there is no train. So sometimes there are a lot of hurdles to reach at that particular locality, and that is the challenge. Overcoming, second challenge, vaccine hesitancy. There is a misconception in the illiterate people. They say, no, it can cause problem in our life. Vaccine is no vaccine. That is a bad, because they don't know the importance of vaccine. So to make a counseling, how it is beneficial, it will not cause any complication to you, don't worry. So these problems are there because some people are resistant. No, we don't want vaccine. We don't want vaccine. This is wrong. One has to give, government is trying to do the counseling with these people. partners who are doing this job. Number one, central government, state government, WHO, World Health Organization, UNICEF, and non-governmental organization are together making different camps to vaccinate the children. What is the impact? What is the benefit? Reduce the disease burden. If the child becomes ill, automatically the children are taken to the government hospitals. And there the doctors will be busy in treating these cases. There will be medicines required. So money matter comes. Efforts are required. Admissions are there. So a lot of stuff will have increased the duties. So when we do the vaccination, the measles cases will be less. Rubella cases will be less. So no hospital burden of money, then the efforts, then the pain. So nothing will be there. No extra efforts will be required to invest in the money and getting our energy over there. Improved child health outcomes. If the child is not getting measles, not getting rubella, happy, you know, the growth will be proper. Immunity will be strong. That is the benefit. Future. When we talk about MR vaccine in the future, what will happen? Continued campaigns, surveillance to maintain the elimination. This is required. We must do the regular camps to give the MR vaccination, and step by step, these both the diseases will be outdated, permanently deleted from India. Okay? Resources. Who are providing some funds for this vaccination? Ministry of Health, then WHO, India websites. You can get all the detailed information, how the funding is done, where camps are created, who are doing this job. All the details you can get on the WHO India website. Second topic of today. The topic's name is Erb's palsy. Can you see Erb's palsy? 2 or 3 things are you can see in the picture. This is the uterus, and this is the pregnancy. Delivery process is going on. This is the head of a child, head of a child, and the doctor is taking that out. Sometime, if it is not easily coming, the doctor has to apply forceps. That is called the forceps delivery. Forceps delivery. Okay. During this delivery process, there are some chances that the child will having the problem over here. Nerves. This is because palsy is always related with the nerve, neurological problem, either spinal nerves or the cranial nerve, but this is related with the spinal nerves. And here is the brachial plexus. Plexus means network. Plexus is network. So don't forget this word, brachial plexus. Please write down. Erb's palsy, brachial plexus. Erb's palsy, brachial plexus. Very important term, brachial plexus. And that is get crushed, damaged, nerves are damaged. And because of that, child will suffer from delayed milestone. He cannot sit properly. He will not walk at a proper time. He cannot maintain the balance. He cannot hold the things in the hand. He cannot walk properly. So all motor activity, especially related with the hands. Can you see here hand? Specific position. This is showing that power is not there. Muscle tone is not there. Muscle power is not there. Okay. So let us talk about Erb's palsy. Erb's palsy is brachial plexus palsy. This is brain problem. This is nerve problem, NERVE, neurological problem. Affected arms movements in the newborn baby due to the nerve injury during the birth. This injury happens during the birth. And how much is the incidence? Very less. Don't worry, be happy. Don't afraid to all the parents, oh, this can happen, nothing. Okay, because this happens 1 per 1,000 deliveries in India. Similar to the global rate. All over the world, the rate is same. 1 in only 1,000 cases, so nothing to be worried about. Causes. What are the cause? Here, cursor, can you see the cursor? I will mark for you so that you can concentrate. Oh, I am sorry. Here you can see forceful stretching. Forceful stretching. Here. If I stretch this, the pressure will be there in the brachial plexus and nerves during the delivery. So forceful stretching should not be done. Symptoms, the child will have that particular right hand or the left hand weakness. He cannot hold the things, he cannot write properly. So all types of the muscle wasting may be there, muscle nutrition may not be proper, muscle tone will not be good. So all these problems from the motor system will be there, not sensory, motor system. Then internal rotation, here, shoulder, internal rotation, inability to raise the arm. The child will not be able, if you ask him, beta, हाथ ऊपर करो, he will not be able to do that. That is because of the Erb's palsy. How we can diagnose? Number one, simple, physical examination. Can you see? Cursor is physical examination. Then sometimes you can do the X-ray of the shoulder joint. Then sometimes, if required, you can do the MRI, magnetic resonance imaging. Okay. Treatment, the most important treatment is physiotherapy. Ayurveda also can do the Snehan and the Svedana Chikitsa, because this, according to Ayurveda, this is Vata dosha imbalance. Paralysis anywhere, muscular weakness, nerve problem, neurological problem, always Vata dosha imbalance. And what is the best treatment for Vata dosha? Oil massage and fomentation. Snehana, Svedana. Gentle oil massage and also the fomentation. And in addition, somebody can give the basti also, medicated enema. That is the treatment of Vata dosha. Next, occupational therapy. How he can work with his school, with his job, how he can combat with the different trainings, how to move the hand, how to do the movements of the fingers, etc. And sometimes, very rarely, some surgical process over here, that locking of the nerves can be separated, and sometimes there will be little bit improvement. Now, early intervention, the disease will slowly progress. So best is to find out as earliest as possible and to minimize the complication. If that damage is increasing, then lastly there will be wrist drop. There will be loosening of the wrist joint. No proper power of that particular wrist or the fingers. Okay. Awareness, limited compared to the developed nation. In the India, very few people are quite aware of this problem, leading to the potential delay in diagnosis and treatment. So there is always a delay. Diagnosis is very late, and naturally there will be more weakness to that particular hand. But fortunately, there are support groups who are helping to this particular problem with each other, emerging to provide information and resources for the families. That bad luck, the NGO will come to your house, they will explain how to do the physiotherapy, they will give the addresses and phone numbers of the physiotherapist, Ayurvedic Vaidyas, and they can start with some Snehana, Svedana, Abhyanga, oil massage, fermentation as early as, and exercises. Of course, exercises are much more important. Financial burden. Treatment can be expensive if surgery is required, especially for the undeserved communities. If the family is a low income group, then there is a burden of this particular disease. Now there is a continuous research is also going to improve the diagnosis, to improve the treatment and preventive methods. What are the prevention? How it can be prevented? Number one, simple, careful delivery. When the doctor, when the nurses, whoever they are there, they should take a large, of course, everybody is taking the care, but one must be very serious about that delivery process, and that should be done very carefully, avoiding the excessive traction. No, don't stretch the arm of the baby. It will cause the paralysis afterwards. So be careful. Prevention is better than cure. Okay. Then government initiative. National programs offer treatment support in some states. They will aid you by financially, by giving the free medicines, by giving the concession in the surgeries. All these things are done by the government. Then What is need for the improvement? Increased awareness. Especially the young doctors who are doing the housemanship, registrarship, incentivist, and also who are learning as a MD and MA students, they should be warned that how to handle these particular cases during the delivery. Okay, accessibility to quality care. By chance it happens, then they must be provided the best quality of the management, Ayurvedic as well as the modern, as well as the physiotherapy. And financial assistance, the government is always providing the free of cost admission, free of cost X-ray, free of cost physiotherapy, all is provided in the government hospitals. So what is the hope? With timely intervention, if you start early Snehana and Svedana and proper support, like for example, Bruhat Vata Chintamani, best medicine. Nowadays, for your kind information, I will tell you in the Bombay, there is a very good Vaidya Patankar sir, and he is manufacturing Sukshma formulations like a homeopathy base, Sukshma Bruhat Vata Chintamani powder, Sukshma Vasanta Kusumakara Rasa, Sukshma Mahayogaraja Gulu. Why? Sir, what is the benefit? Because original one single tablet of Bruhat Vata Chintamani, which is the best medicine for the paralysis, will cost you nearly 25, 30 or 35 rupees. Oh my God. That's why if we want to give the cheaper type of the medicine in the cheaper rate, not cheaper medicine, but cheaper rate, then you can go for Sukshma Bruhat Vata Chintamani, which is available from the Bombay based Vaidya, that is Vaidya Patankar. In viewer, if anybody is interested to get the phone number of Dr. or Vaidya Patankar for Sukshma Ayurvedic medicines, please WhatsApp me on 922681060. I will send them the address and they can get the fantastic medicines, good medicines, best medicine, but in a very economical rate. And that is required in such cases. Okay. So financial assistance I was talking about. Hopeful outlook. With timely intervention and proper support, many children can achieve significant recovery. They will have very less motor neuron damage, very less motor activity damage, very less, no wrist drop, no problem in the handwriting, no problem in raising the hand. So that can be prevented if the early intervention is there. Third topic of today. What is that? Cervical lymphadenopathy. I have already shown you cervical. Now, can you see this baby? I will show you this. Can you see? Superficial cervical. These are the glands. Can you see? Here, exactly here. Huh? Everybody check. Come on. Check it. Cervical lymphadenopathy. Okay. Of course, there are other places are there, but I will concentrate on this cervical lymphadenopathy. This is superficial cervical, and can you see posterior cervical? So these glands, when they are enlarged, that is called as a cervical lymphadenopathy. What is the common concern? Enlarged lymph nodes in the neck. Most of the time, it is because of infection. So you can write down, infection is the cause. Gland enlargement. Prevalent causes. What are the infections? Number one, viral infections. For example, common cold running from the nose. Tonsillitis. Of course, this is not viral infection, but tonsillitis may be bacterial infection. And bacterial infection with streptococcus, throat or ear infection, otitis media. So in all these infections over here in these places, you will get the cervical lymphadenopathy. But my dear friends, you must not forget the most important cause. The most important cause for cervical lymphadenopathy is tuberculosis. Cervical lymphadenopathy, TB. Cervical lymphadenopathy, TB. Cervical lymphadenopathy, TB. Don't forget this word. So tuberculosis is very high rate in the India, requiring the specific evaluation and specific A, K, T, please write down, anti-cox treatment. Very specific. We have already, I think we have discussed this problem, or maybe, no, I think we have already discussed. One video is there already uploaded regarding the epidemiology of tuberculosis. Full lecture is there. So you can just go to the playlist of Sasthavritta and you will get the detailed things about the tuberculosis. There are, of course, 2 or 3 videos. Some are in English, some are in Hindi. So you can see whatever you want. Okay. So tuberculosis, cervical lymphadenopathy. Other causes are little bit less common. Like, for example, Kawasaki disease, forget about it. HIV is important and cancer is also important. So HIV and cancer, these are also another causes for cervical lymphadenopathy. How the diagnosis is made? Number one, history taking. How many days you have these glands? Whether you had cough, whether you have cough, whether you have evening rise of temperature, whether you have loss of appetite, whether you have weight loss, all things are asked in the history. Present history, past history, family history. 3 history are important. Present history, personal history, past history, and family history. So, sir, please repeat. Yes, I am going to repeat. Please write down. Present history. That means how many days you have this problem. Present history. How it is started. Second, past history. Whether you had any another problem like skin problem, asthma problem, heart problem, kidney problem, past history. Then personal history about child, what he is eating, whether he is taking any exercise, whether his friend has any problem, tuberculosis like symptoms in the another measles. So this is like a personal history. Vegetarian, non-vegetarian, then family history, father, mother, etc. So present history, past history, personal history, and family history, these 4 histories are important in any disease. Okay. Then physical examination. Most of the times, if the glands, suppose there are 5 glands here, here, or here, and the 5 glands are stick together, stick, 5 glands, look, stick together. That is called as a matting, matting, matting of the gland. And that matting is a very specific for TB. Cervical matting of lymph gland is a special feature of tuberculosis. Sometimes you have to check the blood. For example, hemogram and ESR. In tuberculosis, naturally ESR will be high. Sometimes you can do the sonography also. Treatment. What is the treatment for cervical lymphadenopathy? It depends upon the cause. If it is common cold, give the anti-allergic. Finish. If it is tonsillitis, Ayurveda has the best treatment. Tonsillitis, Arogyavardhini. You can write down Arogyavardhini. Kanchanara Gulu. Tonsillitis, Arogyavardhini. Kanchanara Guggulu, Triphala Guggulu. You use it, you will get fantastic results. Only when the tonsils are very, very big and kissing tonsils stick to each other, then surgery may be required for tonsillectomy. Okay? Just you can see sometimes if there is a fever, bacterial infection, streptococcal pharyngitis, you can use the antibiotic for bacterial infection and only wait and watch for the viral diseases, because many times antiviral are not used. Okay, so antibiotic courses are there. That course is very important concern in India, leading to the antibiotic resistance. If it is possible, you write down this word. I will explain what is happening. Antibiotic resistance. First time you are prescribing him for cephalexin, either syrup or the tablet. Children, of course, we prescribe the syrup. Now, usually it is said that half spoon or 1 spoon 3 times in a day for minimum 5 days for the cough and all these things, fever. But the parents are having a, what you can say, they are laborers, they have to go to their daily work, rozandariवर जावं लागतं त्यांना, and then sometimes some doses are missed, they are not given. Sometimes, for example, if the child is of 10 years old, 12 years old, what happens? Sometimes they don't have enough money. For example, 500 milligram 2 times in a day, 2 tablets per day for 5 days. So they will have to bring 10 tablets. Remember what I am saying, 10 tablets. Now, 10 tablet will cost them around, for example, 150 rupees. And that particular parents, they only have the 20 rupees, 30 rupees, 50 rupees. They asked the shopkeeper, that pharmacist, please give me only 2 tablets, only 3 tablets. Then they give to the tablet, the fever comes down, cough little bit less, and the child is playing, start playing. The parents are happy, child is happy. But what is happening? Because of the inadequate dose of the antibiotic, next time, if the child is more seriously ill, and if he requires that particular antibiotic, that antibiotic will not work. It will not show you any effect. Why, doctor? Because cephalexin was given for the first disease inadequately, either by dose or either by days, and that is called as antibiotic resistance, is not applicable when you are giving again. I hope this concept is very important, antibiotic resistance in India, because of the poor community. Then importance about the cervical lymphadenopathy, accurate diagnosis, avoid unnecessary intervention. Okay, so if you are quite sure that it is a tonsillitis and you have cervical spondylosis, no need to do MRI. What to do? No need to do biopsy. We are sure it is tuberculosis. Then it is not of cancer. So that these type, when the doctor diagnosing properly, unnecessary economical loss can be prevented. For cervical lymphadenopathy, awareness is very important. Whenever a slightest nodule is there, ask the parents that please come earlier so that infection can be controlled very easily. So educating parents about the common causes and seeking timely is very important. Medical attention is important, crucial. Challenges, access to the quality healthcare. Still, many villages are lacking authentic hospitals, authentic doctors. So, Vaidu and Bhondu and quack doctors, they are treating, they are doing some, what you can say, Andhashraddha, blind faith, and some unnatural things they are advising and they are doing. Okay. Second problem is affordability. That's what I have talked. Antibiotic high rates are not affordable to the poor community, and sometimes diagnostics, blood test, MRI, sonography, they cannot afford. But here, family doctor should request them, if you are not affording the private management, private treatment, please go to the government hospitals, and there you will get free of cost all these treatments. So this is very important to convince to the poor community. Okay. Governmental initiatives, yes, they are doing the immunization, BCG, to prevent the tuberculosis, to reduce the infection causing lymphadenopathy. Research, always in each topic, medical science is upgraded because of the research. They are trying to find out the best, what you can say, material, best kit, best method for diagnosing. Also, targeted therapies, prevention. Simple thing to prevent tuberculosis or any infection is sanitization. That means Mera Bharat, Swachh Bharat Abhiyan, Swachh Bharat Abhiyan, India Clean Movement, Server. That is very essential. You must try to educate the people about the clinical hygienic conditions. They should not eat anytime outside food, roadside food. That is very chances of getting infections. Okay. So hygiene practices, complete vaccination programs help to minimize the risk, early intervention, key to good outcomes and preventing the complications. Fourth point of today, that is herd immunity. Herd and immunity. Immunity is a fighting capacity with the bacteria, with the viruses, with the fungi, with the protozoa. Fighting. Our WBC, white blood cells, are called as soldiers. Neutrophil, eosinophil, basophil, lymphocyte, monocyte. But now we are talking about, in the corona period, this word was very famous. That is called as a herd immunity. This picture, here you can see this color, non-immunized but still healthy people. All these are healthy people. Okay. This yellow color indicates immunization, so they are healthy. And red color indicates non-immunization, sick and always contagious. So when you do, no one is immunized over here. Can you see? No one is yellow. So everybody is healthy, but they are not vaccinated. So what is happening? Contagious disease spreads through the population. It is always spreading because nobody is doing immunization. Next, in the next picture, some of these people, yellow, can you see yellow? They are vaccinated people. So naturally, the spread, some of the population gets the immunized and contagious disease spreads through some of the population. Not all the population is spreading, but some of the population is spreading. And here you can see most of the population get immunization, all yellow. And so spread of the contagious disease is totally reduced. So here red color is maximum, but here yellow color is maximum. So when large people are getting the immunity because of the past infection or because of the vaccination, then automatically the society gets total protection for the society. Total protection, for example, in my Gokhale Nagar, total protection in my Kapila society, total protection in Maharashtra state, total protection for India. Corona was ended, finish, because of this herd immunity. Okay. Herd immunity is also called as community immunity. Can you see this word? I will just, sorry, I will go back. Just a minute. Please give me 1 minute. Oh, no. Sorry. Here. Can you see? Community immunity, population immunity, or mass immunity. These are the synonyms. Is a form of indirect protection that applies only to the contagious diseases, okay, which spreads from one person to another. When this herd immunity takes place, when sufficient percentage of population, nearly 80%, 90%, they are become immune to an infection, whether they can be immune, they can be strong, either they have already corona before and now they are safe because they have already developed the antibodies. The disease has given antigen and the bodies are ready with the antibodies. So second time they will not get the most less time it is possible, they will get the same infection. And some people are already vaccinated properly. So for example, in my Kapila society, I am giving you the example. In my Kapila society, 500 people are living. Please try to understand. 500 people are living. You can write down in your notebook, my Kapila society. Now, amongst these, 100 people, you write down the number, 100 people, vaccination, 100 people only. Up from 500, I am sorry, I will just change the number. I will just change the number. 100 people have already got the corona infection. From the 500, 100 got the corona infection. So naturally, their own body is having good amount of antibodies. So they cannot spread the disease. And they will not get again. They have the good immunity because of the one attack of corona. 100. Then remaining 400. Okay. So remaining 300 are vaccinated. Remaining 300 are vaccinated. You write down the figure. 100 got the corona. So they got the immunity from the disease. Second, 300, they are taking the vaccine. So they are immunized. Okay. So only there 300 plus 100, 400 are finished. 100 are still healthy. They are healthy, but they have not taken vaccination and they have not got disease, but still they will get the immunity because of the whole society is now immunized as good as the strong immunity. That is total immunity for the society is called as a herd immunity. So immunity can be achieved either by, here can you see my cursor, previous infection or vaccination. Once the herd immunity has been reached, disease gradually disappear. From my Kapila society, corona has gone because we all 500 people, herd immunity, not individual, together, herd immunity from a population and the disease will bye-bye, tata. Okay, and may result in eradication or permanent reduction of infection to 0%. This has happened with the coronavirus. All over the world, herd immunity finally developed in each country. In each country. Herd immunity created through the vaccination has contributed to the reduction of many diseases. That's why you were aware that there was a campaign, camps, and repeatedly from the television, from the radio, from the Man Ki Baat, our Modi Prime Minister, everybody was talking, that health minister, they were insisting, they were requesting, please get first dose, then the booster dose. Go. We have started in the corporation, different centers have developed. That is very much essential to protect the whole society. That is herd immunity. So vaccination is the most important source. Vaccine plays a central role, important role in achieving herd immunity for children in India. They train the immune system to fight specific diseases, reducing individual risk and transmission. So they cannot spread. If it is vaccinated, they will less chances to get corona and they will not transmit the corona. But still, there are some problems, that is challenges. Challenges means problem. Vaccine hesitancy. No. We will not take vaccine. Oh, it's painful. It can cause fever. It can cause automatic corona. Lot of misunderstandings. And people hesitate, don't want to take vaccine. That is wrong. That is wrong. Because they are distrust. No faith, no trust on the vaccination. That is bad. Logistical hurdles, reaching the remote areas as like to the mountains, to the forest, and ensuring proper vaccine storage can be difficult. Storage is very important. Some vaccines, they require the ice, and that is not possible in the remote places. Emerging variants, that is called a mutation. The original coronavirus structure of the DNA is always changing. And new variants are coming, new species are coming. And so every time we think, okay, this species is not very strong. This species is strong. Again, the wave will come. And then we think of, oh, what is the new vaccine then? So there are called, the one word you write down, mutation. M-U-T-A-T-I-O-N, mutation. Changing of the DNA structure of that virus. That is a challenge, okay? Government initiative, Mission Indradhanush, aims to achieve 90% full immunization coverage. MR campaigns target mass vaccination against measles and rubella, focus on the marginalized communities, reaching undeserved population is a very important part or important key. Despite challenges, we must accept that progress is good, fantastic, because increased vaccine coverage. We have covered a lot of people with vaccines. Awareness camps are there. Researches are going on. And achieving herd immunity for children in India requires sustained efforts from individuals, from communities, and from the government. By prioritizing the vaccination and addressing the challenges, the safe and healthier future for the children is definitely there. The children can be safe, children can be healthy with this vaccination, with this herd immunity. The last point of today's discussion, muscular dystrophy. Weakness, write down, muscle weakness is similar to the paralysis, muscle weakness. Can you see the stages? The child is trying to get up. How he will get up? He will not immediately stand. He will have to take the support of the hands. Then he will take, second, can you see here? Taken the one hand on the knee joint, taking the support. Then can you see here? Gover's sign. Both the knee joint, he is taking the support and bending down, and finally he can stand up. So this is something like A, B, C, D. These are the steps when he wants to get up from the ground. So this is a typical in muscular dystrophy. Here also another finding. Can you see my cursor? Please see this cursor. Please see calf muscle here. This is a calf muscle. Pseudo hypertrophy. Pseudo, not real. Hypertrophy, big muscle. Calf muscle will be big. Muscular dystrophy in children, in a group of children, is a genetic disorder characterized by progressive muscle degeneration. Step by step, muscle will be damaged. The primary cause is a genetic cause, father and mother. Mutation is there. The X chromosome, Y chromosome, XY chromosome, XX chromosome. So these chromosomes, sometimes genes are not properly mixing. That is mutation of the genes responsible for producing damage to the muscle function. Symptoms. What are the symptoms? First is a muscle weakness. The child cannot stand very instantly. Difficulty in motor skill development. Taking the hands up, writing, walking, sitting, all these are the motor activities. So these will be delayed, and delayed milestone. The child will not be able to sit at a proper month, stand at a proper month, walk in a proper month. So these are called as the milestones. They will be delayed. Signs, some signs are there. Frequent fall while standing, while walking, the child will fall. Trouble in getting up, and there will be waddling gait. The gait is a style of walking, waddling gait, waddling gait. This is muscular dystrophy. Now, what are the investigations? There may be genetic testing, DNA testing, to identify the specific mutation. Mutation is a change in the normal structure of the gene, father and mother, X and Y chromosomes. Electromyography. Can you see the cursor? Electromyography, to assess the electrical activity in the muscles. Muscle biopsy, sometimes done for the microscopic examination, and elevated blood test, creatine kinase. Creatine kinase level in the blood indicate muscle damage. Treatment is focusing on the managing symptoms and enhancing the quality of life. Physiotherapy, definitely helpful, which will increase the mobility, while orthopedic intervention address the contraction. If there is a contracture, we have to do orthopedic treatment, or the scoliosis, bend to the back, scoliosis. Okay. Assistive devices like braces or wheelchairs may be recommended. Medications and gene therapies are being explored for potential benefit. Sometimes they are tried to give the gene therapy or even some specific medicines. There, in muscular dystrophy, the care should be taken by the different experts in the group. So there should be group who is managing this muscular dystrophy. Ayurveda Academy is a group of doctors. Don't forget this. And Dr. Deshpande is a little bit like a coordinator and a director, experienced and this MD person. Okay. So multidisciplinary care, like there should be some neurological specialists, which are called as a neurologist, MS neurology. Then physical therapist, that is physiotherapist, genetic counselors is essential for the holistic management of muscular dystrophy. Early diagnosis and intervention play a crucial role in improving the outcome for children with muscular dystrophy. Here you can see this is a normal bicep muscle here, but here muscular dystrophy, very thin muscle has been developed. Here you can see the muscular dystrophy genetic problem. Here is a healthy father with X and Y chromosomes. Healthy mother, she is a carrier. One X is damaged. Can you see? One X is damaged. So possibility, this particular couple, father and mother, they may have XY healthy son. They may be healthy daughter with XX. Then, or these are all, or possibilities are there. There may be healthy daughter, which can be the carrier because 50% is damaged. Son with Duchenne's muscular dystrophy, specific name of the type DMD. DMD. So whole thing has been damaged, and that person is more seriously damaged. He is actually the patient. She is a carrier. Can you see the difference? Okay. Muscular dystrophy at the age of 2 years, can you see the minimal or no symptoms? Minimal or no symptoms at the age of 2 years. But 8 years, this, you can see the scoliosis is there. Scoliosis may or may not be carrier. At the age of 15 years, can you see the different structures? Muscular atrophy is there, bend are there. Then progression with the age. Weakness will be there, especially of the pelvic girdle, muscles, mixed lordosis, and enlarged calves. Okay, so severe crippling is there, and deformities and contractures are also there. So this is a little bit pity disease, but we must not lose our hopes. There are definitely hopes to maintain whatever the damage and to prevent the further damage. So Ayurveda Academy will definitely help you. If anybody is having cerebral palsy or muscular dystrophy, please WhatsApp us. So my dear friends, this is all about our today's topic that we have covered nearly the 5 things: MR vaccination, Erb's palsy, cervical lymphadenopathy, herd immunity, and muscular dystrophy. So anytime if your exam is there and these questions are asked, you will definitely get the good marks. So thank you very much. Take care. And our next lecture will be on Sunday in the morning with Swasthavritta and in the afternoon with Charakuttarartha. So once again, I wish you all the best. Take care and see you in the next our lecture. Thank you very much.